Okay, good. Let's go back. Let me just quickly go through once more. Vital signs, main four vital signs that we would be looking for as a medical assistant: temperature, pulse, respiratory rate, blood pressure. Okay, but you have add-ons, so such as the GMR, which is the glucose level, or the pulse ox, which checks the oxygen level of the blood, right? Now the body temperature, some measure of how hot or cold the body is. However, as you know, an elevated temperature um, may indicate that something may be wrong with the patient. Now, a fever is different from just elevated temperature. Your temperature could be elevated, but you're not having a fever. A fever is at a certain level. Okay. Now, in terms of your body temperature, it can be related to an infection, but it can also mean that something is wrong with an organ in the body. It could also mean that there is some form of cancer, or it can mean that something is wrong in terms of the blood itself, a metabolic disturbance with the blood, right? Now, there are two types of thermometers, right? And if you were to go to the former office, you would realize that we use two types of thermometers. So you have the electronic thermometer, you have disposable thermometer. Actually, this is considered a disposable thermometer, but most persons believe that it should be reused multiple times. But it's actually considered a disposable thermometer. Okay? The same one. As you know, most especially before the COVID, we used to wipe it off and still use it again, but it's considered disposable. Yeah? Well, you also have to have ways in which you would protect not only yourself but patients, right, from organisms that may harm you. So in terms of you doing a actual vital, well, in Jamaica it's not more so an issue, but abroad they usually put something over the probe to check the temperature before you actually use it on the patient. Somebody that's doing oral temperature check. You also have the axillary temperature. You may check the rectum. You check the rectum in babies. Right? So it's under the arm. You normally check the temperature. You ask the person to squeeze onto it while it's under their axilla, right? And wait for a indicator, usually in the form of a sound or beep, indicate when the temperature has to be read. Usually you want to ensure that the surface is not wet or the person hasn't been sweating a lot. So you have to dry the area before you take it. Now in terms of record keeping, now there are certain facilities, especially at the hospital, that uses temperature charts. Right? You could actually go online and look upon different temperature charts or vital charts. The vital charts will check the temperature, pulse, may also have an area where you do blood pressure, okay? And it will have the demographics of patients. You will always check the patient's name tag. So before doing any daily vitals, before doing any procedure, you check the name tag of the patient so that you can identify and ensure that that is the right patient. Because it's very important for you to put the right vitals for the right patient. Otherwise, it can cause a lot of problems. Right? So, normal body temperature ranges from 97.6 degrees Fahrenheit to 99.6 degrees Fahrenheit. Right? A temperature above 99.6 degrees is hyperthermia or a fever. Therefore, you can realize that is not every time when your temperature is elevated, it is considered a fever, right? It is usually considered a fever when it's above 99.6, right? A lot of person might see the 99.6, 99 and be saying, hey, I have a fever. It has to be above 99.6, right? Now for the pulse. So remember the different routes for temperature test: mouth, which is oral, underarm, and rectum. Okay. Pulse, the wave of blood created by the heart pumping as it travels along arteries. It is felt when an artery is partially occluded by two fingers. Never use with thumb because it has a pulse and can be confused with the patient's pulse. So if you check the patient's pulse with your thumb, you may actually get a pulsation and you may be thinking that it's the patient's pulse when it's actually your own pulse in the thumb, right? So you don't check the patient's pulse in your thumb. So using two fingers, find the radial pulse along the two sides of the wrist, okay? And the radial pulse is located on the lateral aspect of your arm. So when you put your palm facing up, right, you would realize that the pulse is on the side where you have the person's thumb. Okay, so the person's thumb is right here, and you would check the pulse right underneath the thumb. Okay, it's below that little bony aspect of where the thumb would be. Okay, all right, listen exactly where it's at. So it says using two fingers, find the radial pulse along the thumb side of the wrist. Count each pulse for 30 seconds while watching the second hand of the clock. Okay, so you would count. So you watch, you have to concentrate now. So you're looking at the clock and you're waiting until it reaches 30 seconds. So you could start counting when the clock, when the second hand goes to the 12. So you know exactly where 30 seconds is. You start counting each pulsation from the clock hits the 12 or from the watch hits the 12 until it reaches 30 seconds. Right? Now, if you get six, right, six beats in that 30 seconds, then you would notice that what you're looking at is a just for calculation sake, but that would be too low. But six beats within that 30 seconds would mean that it is 6 times 2, right? To give you the amount of beats that you got per minute. Right? Therefore, it would be 12 beats per minute, which is very low. Right? In a 30 seconds period, or in a 60 seconds period, on average, your pulse should be around anywhere around 60 beats per minute. Okay. Therefore, what you should have is 60 beats within that 60 seconds. It should be 30 beats within that 30 seconds. Okay. It is not going to be that small of amount. For most persons, it's 70 beats per minute. So within 30 seconds, on average, you're looking at about 35 beats in that 30 seconds. So you can see where you have to really be concentrating, or you might be losing track of how many beats you have per minute, right? So remember, you check with 2 fingers at the radial aspect, which is where you have the thumb. You look at the clock or you look at the watch, and it starts from the first second to the third second to the 30th second. You're supposed to count all the amount of beats that you got from start to finish. Okay. Now ranges that may be low. One, if the pulse is less than 60, it is considered low. Okay. If the pulse is greater than 100, it is of concern. And if the pulse is greater than 110, it is of grave concern and need to be reported. Okay. All right. The other things that you can check for in terms of pulse is the rhythm of the pulse. So the pulse should always be beaten at the set time, right? You may have an irregular pulse whereby you may have a pulse now, then a pause, then a pulse. Or you can have a pulse now, then a pause, then a pause, then a pulse, then a pulse. Or you may have a pulse, 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 pause, pulse, 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 pause. Those are considered irregular pulse. Mhm. Measuring respiration. So after counting the pulse for 30 seconds, leave the fingers in place to count respiration. All right. Do not tell the patient that you're counting respiration. One respiration equals one inspiration, rise of the chest, and one exhalation. So don't tell the patient that you're checking their breathing. If you tell the patient that you're checking their breathing, then what is going to happen is that the patient may start breathing faster than normal, right? Or may start breathing lower than normal. So while you're checking the person's pulse, you will look at their chest, right? And you may see where the chest picks, where they take a deep breath in. That would not be considered a respiration. It's when they take a deep breath in and then out. That is one. And in and then out, that is two, right? So you can check the you can check the respiration while the person is aware, and you're not supposed to check the respiration um, if it's a case that the person just takes one an inhalation only. So it wouldn't be an inhalation and an exhalation to make two. It would be inhalation and exhalation to make one. Okay. Same procedure, but this time it's even a bit more challenging. So you can't keep your eyes on the clock while checking the person's respiration. So you have to be there looking, right? So what you have to do is that you look at the clock when it reaches 12, you start counting. You get a rhythm of what the person is how the person is breathing, so that once you move your gaze from the clock, you would have known that the person made another breath, which is enough one that would have been while you were looking at the clock to see if the 30 seconds had passed. Is everybody understanding so far?
So far, definitely.
Right. So the other thing is for the inspiration, right? For the respiration is that you may have different forms of respiration. So you can have fast respiration, you can have slow respiration, you can have no respiration. Okay. In persons who have very fast respiration, it's called shortness of breath or tachypnea. Tachypnea. Tachypnea, right? Meaning that they are having fast breathing. You may have also fast pulse, and the pulse is called tachycardia. Right? Tachycardia, fast pulse, tachypnea, fast breathing. Okay?
Is that tachycardia spelled Tachycardia? Is that the one?
Yeah, right. That's the one. Mhm. Now, in terms of tachypnea, it may be related to some form of respiratory distress, right? Of which you're going to have to address. Persons that are having slow breathing, slower than normal breathing, it may be that they're having obstruction, so they can't take a good breath. Or it could be that they're dying, right? Persons that have no respiration at all, majority of the times they're dead. Okay? So count each respiration for 30 seconds, multiply the pulse and respiration by 2 to get the number per minute. Okay? So another way to actually find out, okay, about the respiration is to multiply the pulse and the respiration by 2 to get the number of per minute. And we knew that already. So if in 30 seconds you got nine breaths in that 30 seconds, and it's 80, which is the normal amount of breaths per minute. Okay? The normal amount of beats per minute or per pulse is 72 beats per minute. Right? Again, you have the charts that you use: pulse, respiration, right? Temperature. And then you record the blood pressure at each bottom. Normal pulse rate. So the normal pulse rate for an adult ranges from 60 to 90 beats per minute. Normal pulse for a child or infant may be higher than an adult. A pulse that is lower than normal is called bradycardia. A pulse that is higher than normal is called tachycardia. Okay? The bradycardia, lower than normal. Tachycardia, higher than normal. Normal respiration rate for an adult ranges from 12 to 20 breaths per minute. Normal respiratory rate for a child or infant may be higher than an adult. A respiratory rate lower than normal is called bradypnea, and a respiratory, this should be respiratory, a respiratory rate that is higher than normal is called tachypnea. Now let us move on to blood pressure. The blood pressure that is exerted against the walls of the artery. So it's the pressure. And we already discussed this when we were having cardiology, right? The pressure that is exerted against the walls of the artery is called the blood pressure. When the heart contracts, the pressure is the greatest and it is called the systolic pressure. So you have that top number, and that top number represents the pressure that the heart has to pump against when it is contracting. So like the pressure in the left ventricle of the heart, when it squeezes, to push it into the aorta, that pressure is called the systolic pressure. The heart at rest the pressure is lower and it is called the diastolic pressure. Okay? You have systolic pressure, you have the diastolic pressure. Now, we have equipments that are used for blood pressure. And at our office, we do not entertain the use of electronic blood pressure machine, right? Though we do facilitate it if somebody is there, but we try to ensure that the blood pressure is checked with a manual blood pressure machine. Okay, it allows you to get a more accurate reading, and it allows you as a staff to have a better experience when it comes on to checking blood pressure. What you need for blood pressure checking is a thermometer, is a stethoscope, my apologies, and a blood pressure cuff. Okay, they sell the manual blood pressure cuffs in the pharmacy. I believe they sell it for like 2,500. They can purchase it. And it comes, some of them come with a stethoscope inside. Okay, you could buy the pack from a pharmacy.
I will
Right?
put them.
Okay. All right. So let's place so blood pressure cuff placement. Place the cuff securely around the upper arm about 112 to 2 inch, 1.5. This should be 1.5 to 2 inch above the elbow. Okay. Align the artery arrow along the inner aspect of the upper arm. All right. So on the blood pressure cuff, there's going to be a signal that says artery. Don't neglect what this is a sign, right? You're supposed to put it in alignment with the artery. The artery runs right along the medial side of your elbow. Okay, so where you have the medial aspect of your elbow, that's where you're going to find the artery. Okay, so you put the signal right in line with that artery. Okay. Okay. Now, on the blood pressure, you're going to have a valve control knob and you have a bulb. Right? You close the valve. Okay, so you roll it up so that it's closed, and then you inflate the cup by squeezing and releasing the bulb. So you squeeze the bulb, release, so that the blood pressure can be checked. Okay, what you're going to do next is to put the stethoscope right at the area where the artery is located. So you didn't put the cup onto where the artery is located. It's 2 inches above the artery. The artery is right here. This is the person's chest right over here. This is the person's arm here. So it's on the medial aspect of the arm, not out here. They put this little signal right at the medial aspect of the arm. Okay, right here where the artery is supposed to be, you're gonna put the stethoscope right there. Right. So it has it right there where the artery is running, and she has pumped up the blood pressure cuff to a point where she's safe to say, hey, it's above the systolic pressure manometer. To place the bell of the stethoscope over the brachial artery. You can look up where the brachial artery is in pictures. When the patient's pulse is no longer felt, continue inflating the cuff until the manometer reads approximately 40 millimeters of mercury higher. So what you're going to do, you're going to be listening to see if you're hearing a lump, 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 lump sound. You try to pump the blood pressure cuff until you're not hearing that lump, 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 lump sound. Okay? This means that you had reached a point where it's a little above the systolic pressure. A safe point to put it would be maybe 200, right? And you stop it at 200. If you're hearing the blop, 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 blop sound at 200, try to make it go above 200. But you have to get a point where it's complete silence. You're not hearing anything. Okay? Once you reach a point where you're not hearing anything over the artery, where you place the artery, you're gonna slowly pull the valve to release out. You can't pull it too quickly or everything is gonna just escape. So you slowly pull it like slowly. When I mean slow, it's like extremely slow. Just a little, huh? Like what they said. So just a little release. Right? Hello? Okay. Just a little release to allow the manometer reading to start falling back to the systolic level. Right? It says listen for pulsing sound called character or character sound. Okay. When the first sound is heard, not the pressure reading on the manometer, this is called the systolic pressure and should be the larger unit. So the first sound that you hear when you release the valve, and remember it's very slow, slow to the point where you're just seeing the tick just barely moving. Then you're supposed to record that as a systolic pressure. You're going to continue hearing the noise, but you don't quickly open that valve. You continue to allow it to slowly descend from the value. And when you notice that the sound has disappeared completely, that lop, 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 lop sound has disappeared completely, you record the reading at stop. And that would be diastolic pressure. Alright? Once you've recorded both of those, you release you open the valve and you remove the cup.
So ultimately, blood pressure is basically systolic over diastolic. Or is it the other way around?
No, the reading. So
Reading.
the systolic pressure is at the top, the diastolic pressure is at the bottom.
Right.
Normal blood pressure is 180 or 120 over 80, right?
Yeah.
20 over 80 is the ideal. On the vital sheet, normally it's recorded at the bottom. So there's an area that allows you to write in the systolic and an area
Right.
that allows you to write in the diastolic.
Diastolic. Oh,
So again, normal blood pressure, normal systolic for adults is 100 to 120. Normal diastolic is 80. This is not standard for everywhere because some places they don't accept lower than 60 for the diastolic.
oh,
Right? A blood pressure that is lower than normal is called hypotension. And a blood pressure that is higher than normal is called hypertension.
right.
Protect yourself and patients. Always remember to wash your hands before and after every patient contact to protect yourself and your patient from the spread of harmful organisms. All right. So any questions so far?
Yes. In terms of the coming in with the practical, maybe there's some information I'm missing.
I'm not hearing you. Go again.
Can you hear me now?
Yeah, man, I'm hearing you.
Okay. Okay. So maybe I'm missing some information, but in terms of the practical, we have the office in Portmore. I think that's one at the Greater Portmore Plaza. Is that one open and available?
Yeah, man, it is. All right. It closes at 8. So
At eight.
regardless of what time of the day, you
Mm-hmm.
can spend an hour, 2 hours. It doesn't matter. Just come in, see what's going on,
Yeah.
and how you do certain vitals, because it's
Okay.
important, right? I'm
And
actually in the process of getting some additional places. I'm reaching out to Cutis Skincare for someone in Mandeville. Um, in Clarendon, I'm reaching out to the Mapen Healthcare Group. So persons in Clarendon should be able to get some experience as well from that end.
because I'm
Right?
definitely considering this coming Friday, or later down in the day after work. But you can always put me on the list if
Okay. All right, no problem.
as
All
well. I
right.
can
As
always
I
come
told you,
by.
as long as you introduce yourself, then you should be fine. There's no restriction.
Okay. Okay. So it
All
wouldn't
right.
be a problem if I stay there for like the 2 3 hours to get as much as possible.
No, there's no issue.
Okay.
Dr. Tracy,
Hmm.
is
Hmm.
it only for this week?
Oh, I can hardly hear you. Go again, please.
Is the practical only for this week?
No, it's straight through. It's straight
Okay.
through. Mm-hmm.
Whenever
Okay.
you're available.
All right.
Okay.
Hmm. All right. Now you have what is called the pulse ox. The pulse ox has certain readings that you look for. It checks your pulse, right? It checks your oxygen saturation. Now, a normal oxygen saturation would be 95% and above. Okay? So 95% to 100 would be considered a normal oxygen saturation. It's a very small machine that you just put on the finger, nothing big.
Yeah.
Once you put it on the finger, then it starts reading. What you need to know though is that the part with the monitor that you read, it faces in the direction of the nail. Okay? So when you put on the machine, the pulse ox, it's
Uh-huh.
going to fit the area that you read should be facing the direction as to where your nail is. Okay, so you wouldn't put it on the underside of your finger. Would be you would put the monitor the monitor area in the direction of the fingernail. Okay, simple, very simple one too for that one. Okay, anything that is lower than 95 is considered abnormal. Okay. For the GMR machine, it's a simple prick to the finger, squeeze, and you put the blood on the GMR strip while it's in the machine. So you put the GMR strip first, then you put the um, so you put the GMR strip into the machine, then you put the blood onto the GMR strip while the strip is inside the machine. Okay, readings that you may get low blood sugar, right? And I would say anything below 4 is considered low. For a normal person, your GMR should not pass 7.2, right? If it's higher than 7.2, within the range of 9 or 10, then it is considered elevated, okay? And could be a sign that you have glucose intolerance. If
Mm-hmm.
your GMR, which is your blood sugar, is greater than 10 or 11, then we would consider you diabetic. Okay. The GMR, however, is a non-specific means of you checking to see if somebody is diabetic. So when you take the sugar and if it's high or if you deem it high, you do not say to the person that you're diabetic. All right? Unless like in its 20. You say to the person that your GMR is elevated. Okay. However, the doctor is going to determine whether or not you are diabetic. And how the doctor determines that is by doing what we call an HbA1c blood test, HbA1c blood test with fasting test. And that usually diagnoses if the person has diabetes or not. Any
Dr.
question?
Tracy, Dr.
Yeah,
Tracy,
man, yeah, man, I'm
good
here.
afternoon.
Good
Can you
afternoon.
please send the slides into the group, please?
Yeah, man, I will.
Thank you.
No problem. All right, so that's it for this evening. Just once you get a chance, once you get an hour of the day, during the week that you could just stop by, get some practice, then do so that you can just get a little hands-on experience, so that by the time we're finished, you can say, hey, I'm comfortable doing these vitals. Okay?
Right.
All right,
Okay.
no problem.
Dr.
Right.
Tracy?
Yeah, man, I'm here.
Yeah. Where exactly is your office? Is it the Don Robin location?
Oh, so I'm not really stationed at one of them. I just mostly work at Portmore in the evening. It's one big group of us. So I am usually at Portmore in the evening, but there's a doctor that is always going to be at one of the location, and there's always a nurse that's there.
And they
So,
have been listening to the
Dr.
persons so that
Tracy,
when we go there, we're not strangers to them.
Yeah, man, most definitely. I'm gonna put it. I'm gonna send it out as a broadcast to them so that they're
Okay.
here. I'm gonna send
Like
the
there's
link.
a list of expected persons coming in.
Right. Okay.
Dr. Tracy,
Okay.
what time you normally leave the Portmore branch in the evening, night?
Oh, we close off at 8.
You close at 8. All right, then
Right.
I think I'll be coming to the Portmore branch,
Okay, no
but I'll
problem.
call you directly the day that I'm coming.
Yeah, man, that's fine.
Okay, thanks.
All right, no problem. Well, take care, everybody.
Before you go, random question. Sorry
Okay,
about
that's fine.
off the record question. I really want to do this. Let once we have our fully certified, I definitely
Mhm.
want to look at some of the benefits. Is would we get any gym discounts?
We get any
Gym discounts?
gym discounts
No, no.
again?
I get no. I'm saying it's like off the record question. Once we become certified and of course employed, and it's not, of course, the context is all over the place, but I'm looking forward to a gym discount if that's possible.
Oh, you mean a discount when you come to the office?
No, not the office. All right, tell you what, don't worry about it.
Are you
I'll,
affiliated with any gym, Dr. Tracy? That's what he wants to know, that you can get discount on the gym fees.
Oh, okay. No, but that should be something that we could start out. It shouldn't be a
please,
problem. It shouldn't be a problem at all.
please.
Right?
All
I
right.
think once you actually present your ID, regardless of wherever you work, once you
Mm-hmm.
present your ID as a healthcare
Worker.
professional, you
Yeah.
automatically get some form of discount for anywhere that is offering um
Right.
that there's no discrepant, there's no bias as to where you're working, regardless. As long as your company presents you with an ID that shows
Mm-hmm.
that you are a healthcare professional,
Right.
then they should offer that discount. Mhm.
Okay.
All
Okay.
right.
Not a problem. Yeah.
Yeah, man, no problem.
Thanks.
All right, no problem. So I will definitely send it, Andrea.
Okay, thank you.
Okay, you're welcome.
Take care, everybody.
Bye.